Hello everyone, good afternoon. My name is Diana Reyes. I'm a public health researcher based in southern Turkey. I'm sorry I couldn't be there in person today. Unfortunately, I've been traveling for work, but Becky was understanding enough to allow me to give this presentation remotely, so I hope it's beneficial to you all. My title is WhatsApp as a Communication Tool and Beyond, but you'll find that this is more about the need for psychological support of aid workers that are working inside Syria. I work for the Syrian American Medical Society as a project coordinator. This project is funded by the Johns Hopkins Center for Humanitarian Health through the School of Public Health. I wanted to provide some background on the Syrian conflict, which, as you may know, entered its 7th year this March, began in March of 2011 during the Arab Spring. It's been described by the United Nations Refugee Agency as the great tragedy of the century, as about 5 million Syrian refugees have joined a grand total of 50 million refugees displaced worldwide. This is the most since World War II. Inside Syria, there's about 7.6 million people internally displaced. A statistic I found a little puts things into perspective a little bit more is that an average of 6,150 Syrians were displaced per day in 2016. Unfortunately, there's no imminent end in sight for the Syrian people due to the ongoing presence of domestic and foreign military, including armed groups and also terrorist organizations. So Syria is considered a complex humanitarian emergency, defined as a grade 3 by the World Health Organization, which means that there are substantial public health consequences inside Syria that require international response. Syria joins the ranks of Iraq, South Sudan, Yemen, and Nigeria. So there's a couple of numbers on this page, but I thought that they were important. These are from the Syrian Regional Response Health Cluster, which reported that 13.5 million Syrians are in need of humanitarian assistance, including food and livelihood, while 12.8 million require health assistance, including conflict-related injuries from the use of barrel bombs and incendiary weapons. So in 2016, there were lapses in cessation and hostility agreements, which unfortunately further deteriorated the humanitarian situation inside Syria. And of course, not mentioned on this slide are the social consequences of the ongoing conflict, including the stress of displacement, the uncertainty of the future, and the lack of basic needs and supportive services on a daily basis. So a little bit about where I work. I work for the Syrian American Medical Society. Also, I will refer to this as SAMS throughout the presentation. They were founded in 1998. They're based in Washington, D.C. It was founded as a professional society for physicians of Syrian descent, sort of organizing medical missions and conferences and charitable missions. However, in 2011, SAMS shifted its mission to meet the growing needs and challenges of the medical crisis inside Syria. So we support healthcare throughout Syria. We sponsor field hospitals and ambulances, train and pay the salaries of Syrian medical personnel, and provide medical equipment when needed. So in 2016, SAMS provided nearly 3 million medical services to Syrians, as well as conducted a number of medical and dental missions. So I thought it would be important to highlight how the humanitarian response system works inside Syria, because it's put us in this sticky situation that I will elaborate on later. So from Turkey at least, SAMS and other NGOs operate from Gaziantep, which is a city 90 kilometers north of Aleppo. We support field staff and medical facilities in northern Syria, but from a distance. This map here does a better job at explaining the Syrian regional response, which includes response from Amman. You can see the purple star there in Jordan. They address the humanitarian needs in southern Syria, while Gaziantep, which is where I am, covers northern Syria. And not included here, but in the center of Syria is the Damascus hub, which covers central Syria. So I will speak mostly for the Turkey response, although the situation for aid workers, I would say, is similar throughout Turkey and Jordan. Given that understanding of how the humanitarian response is coordinated geographically, SAMS is doing research with the Johns Hopkins Bloomberg School of Public Health, as well as the International Rescue Committee, which is based in Amman. We're doing a study together on the ethical challenges faced by humanitarian health providers in context of extreme violence inside Syria. Basically, I speak directly with humanitarian health providers based in Gaziantep, Amman, and inside Syria who are working actively on health response. And when I first started this work, I thought ethical challenges would be more related to principles of medical neutrality, definitely attacks on healthcare, which I will touch on in a bit. But one of the main problems that have emerged is really the lack of psychosocial support of field staff inside Syria, as well as those based in southern Turkey and Amman. So overall, field staff are complaining that they do not receive this kind of psychosocial support they need from their organizations. And so I think there's opportunity here for a lot of work. And let me not get ahead of myself. So let's keep. Now, despite this talk being centered around aid workers in Syria, there's challenges that are faced by remote coordinators too. And this is what has emerged from our research when speaking to coordinators based in Turkey. The first of which is the lack of cross-border access from Turkey. Since 2013, borders have been tightened. It's more difficult for staff in Turkey to travel to Syria and vice versa to provide humanitarian aid. And this has also made the delivery of supplies much more difficult. The next issue is the unrelenting conflict has led to this trend in which hospitals and facilities that provide healthcare are continuously targeted. And unfortunately, here at SAMS, we've had field staff who were lost on the job. Now, obviously, this shouldn't be the case, but the organization may have that feeling that they are responsible for the lives of the field staff and of their families. So all of this pressure sort of on remote coordinators who can't even be inside Syria to help the field staff, and no psychological support for these staff that are coordinating from Turkey makes it quite difficult to continue. And just being here and watching the humanitarian response unfold, I've noticed that there's high burnout rates of remote coordinators based in Turkey and lots of turnover. However, there is some progress. The World Health Organization Mental Health Psychosocial Support Group here in Turkey have been putting together self-care policies for staff working in Turkey. So there's some work being done, but obviously a lot more can also be contributed. In terms of the challenges for field staff in Syria, they are many. And while, for example, highly educated doctors, nurses, medical assistants, and lab technicians continue to exist inside Syria, few specialists remain and few that are experienced in their work. So often nurses are carrying out the work of doctors, or midwives are carrying out the work of nurses, and so on and so forth. So these have emerged as challenges for field staff, is that they're under this immense amount of pressure to deliver healthcare that they're not necessarily trained to do. On top of that, field staff often experience chronic distress about their family, whether their family is near them in Syria, they're afraid of them being targeted, for example, or they're just distressed that they're far from their family and they don't have that social support system around them. Another thing is a future inside Syria and often looking towards opportunities to migrate elsewhere. Essentially, medical professionals in Syria have a price on their heads, and I'll talk about attacks on healthcare on the next slide. Unfortunately, attacks on healthcare have become a weapon of war inside Syria. SAMS reported 176 attacks in the latter half of last year. This included some of our facilities and healthcare workers. This is obviously a violation of medical neutrality, laws of impartiality during war, and many kinds of humanitarian law. And for our workers, especially those serving in opposition areas or technically providing care to rebel soldiers or any armed militia member, their job is to provide health care and nothing else, regardless of the person. And I found this quote from a field staff member who said, "Our operating table is a place of peace, indiscriminate of armed fighters, regime military pilots, and terrorists." So you can see how these hellish circumstances, honestly, uh, would affect the well-being of anybody, let alone aid workers who continue to live inside Syria. So on top of the unrelenting fear of being targeted and losing colleagues, friends, patients, and family members, it becomes unbearable. In terms of some of the qualitative interactions I've had with field staff, I heard this theme of abiding conscience being mentioned. So, sort of guilt that follows around the field staff, no matter what they do, of the lives they couldn't save, which makes them work even harder and longer shifts and hours to try and fill this gap, which is impossible in a war zone. And some end up just having to flee for their own well-being, but then suffer from the guilt of leaving their country and civilians. So overall, I will say that there's been a systematic deterioration of the well-being of aid workers after nearly 7 years of being targeted and working under these circumstances. I will correct myself in this slide and will say that their morale has not deteriorated. I think that their morale is higher than ever, and they continue to do the amazing work that they do. Unfortunately, their well-being is at stake. So an observation I made during my time here in Turkey is how often WhatsApp is used. So I noticed that there's ongoing communication, very informal, between remote coordinators and field staff at all times. So this is the way SAMS carries out their work. It's very effective. And I had an idea of how WhatsApp and other communication tools that are used online can be used to support field staff or vice versa. I mean, this could be daily communication that's focused more on psychosocial well-being. Hello, how are you? How's it going? What do you need today? Or something more formalized. But WhatsApp is great because you send voice notes, you make voice calls, and you have the opportunity to exchange messages and emojis, even pictures too, and videos. So I thought that there's an opportunity here to set something structured between a remote coordinator and a field staff member to bring them together. This has not been launched yet. This is an idea that I had that I'm working towards. So the first step was that there's a dearth of research on this topic, so to do something about it. There's really little research on the mental health and psychosocial well-being of aid workers in Syria, namely those providing emergency relief and who continue to work inside. So I recently proposed an assessment of the mental health needs of SAM's field staff. We're using the Hopkins symptom checklist as well as some psychosocial follow-up questions and demographics, and sort of hoping that we can use these communication tools to our advantage, mainly because we have a lack of direct interactions with them and face-to-face opportunities. So we're working towards something along these lines. And the hope is that by tending to the mental health and psychosocial needs of our medical staff and humanitarian health providers, that they continue to be able themselves to take on this gigantic responsibility on their shoulders of leading humanitarian response and providing the healing that Syrian civilians need and the health system needs overall. We had some ideas about implementing this sort of on a daily basis, like maybe a doctor-to-doctor exchange or a buddy system where a field coordinator is paired with a remote coordinator. Obviously, there will always be room for improvement and for formalized services for aid workers inside Syria, so I'm hoping that the assessment can at least gather some statistics and raise awareness about this issue, hopefully get the attention of donors and so on. I think that remote coordinators can fill an incredible role by prioritizing the psychosocial needs of their aid workers through needs assessment, ongoing research, and namely communication. And furthermore, just making sure that field staff know that remote coordinators and their organizations care and want to support them psychologically. I think on a very long-term note that the mental health and well-being of this population, that being field staff, contribute to the overall quality of the response in these emergency settings as well as this crisis. And like I said before, the health systems inside Syria. So it's a lot to take on, um, sort of at once, and I know I deal with this every day. So there are options of what you can do to help. I thought I would include these links here if they're helpful. I was recently connected to the Syria Public Health Network. It's a group of Syrian British physicians and academics who run public health campaigns and do public health research on Syria. Feel free to check them out. There's the Syrian Association for Mental Health, which does great work here in Turkey as well as, I believe, in Europe. In terms of research, I'm sponsored by the research grant through the Research for Health and Humanitarian Crisis. There's the link there, and as well as the Johns Hopkins Center for Humanitarian Health. As always, you can volunteer and donate. I put the SAMS link there in case you're interested, and thank you very, very, very much. Please feel free to contact me. That's my email right there with any questions. Have a wonderful afternoon. I hope this was short and sweet, and hopefully was comprehensive enough. And thank you, of course, to Becky for putting together this innovative conference and for bringing all of you and us together, albeit digitally on my end. So thank you so much for having me.